What's up and welcome to Digital Nomad Health. My name is Mohammed Ashori MD. I go by Dr. Mo. The channel is also sometimes called Expat Health, or at least that's what it used to be. And today I want to talk about patient advocacy. What's the importance of it, how I use it in my practice. So a little bit about me. I'm a board certified family medicine physician. I practice out of beautiful Los Angeles, Long Beach, but I'm also a digital nomad. So I travel a lot to Spain, Mexico, Iran, other places. So you can find me in a lot of different places in the country, but you can always find me also online. And that is why I built my practice to be mostly online. What I've found over the years, and the reason I have switched over from this insurance-based system over to the cash-based system is because the people who get caught up in the health insurance system tend to not get the best kind of care. As a generalization, not always, right? You can get incredible care in the health insurance system. But for me, I was not able to navigate it the way I wanted to. And so I created this cash-based system. The cash-based system is nothing new. It's been around forever. There's always thousands of doctors who are doing some version of it. There are gastroenterologists, proctologists, dermatologists, rheumatologists, surgeons, and everything else in between who engage with the patient in a healthy patient-doctor relationship, but there's nobody else in between, meaning I charge my patient for a certain amount, they pay me directly, and I'm a fiduciary to them, meaning I'm responsible for my patient. And I like that. I think it makes me feel good. But on occasion, you need support, you need help, you need resources. And that's the one thing that I think I'm good at as a physician, or have to get very good at, is finding a lot of great resources, scouring the internet, talking to different physicians, talking to different CEOs, talking to different companies, and figuring out how can I get the right resources for my patients so that they can have the best possible health outcome. Focusing number one on their health, number two on their goals, and number three is the last one and very important one is the finances, so that they're not going broke or spending so much money on their health that it doesn't make any sense. So one of the most important things, and I've pulled it up here on my giant screen to my right, is patient advocacy. There are many, many different types of patient advocates. There are board certifications for patient advocacy. There are patient advocacy groups. There are public patient advocacies. There are community health patient advocates. What is a patient advocate? It could be anything. It could be anything. It could be somebody who's going to guide you through that diagnosis of a major autoimmune condition. It could be somebody who's going to guide you through a cancer diagnosis. Whatever it is, the patient advocate is the person who not only connects you with a lot of resources, but is someone who can take you through a lot of really complicated processes. Probably one of the most complicated things that many of my patients deal with is they still have the health insurance system. They need it because they don't feel safe without it. But then they're also paying for me on a monthly basis to be part of my membership, part of my practice. And thank you for doing that. However, whenever you dabble in this health insurance system, it's very easy for things to quickly get out of control. All of a sudden you get a $10,000 bill, all of a sudden you get this one procedure, ended up being out of network, $180,000 hospital bill, ICU stay, etc. So I want to read from Intune. It's Intune Health Advocates. So our healthcare system is often overwhelming and confusing. We can help. Intune Health, INTUNE, works with clients in the Chicago area and beyond to help them navigate the healthcare system, including insurance and billing issues. We partner with and listen to patients and caregivers so they get the healthcare and support they deserve. We want your care to be coordinated, streamlined, and in tune with your needs. I love that. I think what I get from that is that, yes, sometimes you're going to use your health insurance and all of a sudden you're going to find yourself in a really bad bind. The classic examples or what I mentioned, a really huge bill, and you're like, this is ridiculous. How am I going to afford to pay this bill? Or a claim that gets denied, or a procedure that should get paid by your insurance, but they're not willing to. Or you need a certain type of surgery that your healthcare system is not offering. Now, I always think the number one place to go is to your primary care doctor, and that is always me. Whether you lose your insurance, whether you change countries, whether you change locations, whether you change jobs, I will never change. I will always be your primary care doctor, meaning I will be your first person to go to. Now, my practice is kind of unique because I mostly focus on chronic disease prevention. So it is quite common for my patients to still have somebody else on their team that might be a family medicine doctor or an internist, etc. Anyway, we'll get into that details if you become part of my practice. What is quite important to me is that you always have resources available to you should something bad happen. So if I, as the first line of defense, can't help you through this problem, there are these wonderful patient advocates out there. So one of them is Intune Health. Another one that I really like a lot is Allen Health Academy. So that's Marshall Allen, who wrote a wonderful book. I forgot the name of it. It was like Never Pay the First Bill. And he has great resources available. There are lots of people you can search out on LinkedIn who are patient advocates who can be your advocate should there ever be a major financial need, or of course a major health catastrophe or health need. Fortunately, health advocates are not expensive. You can afford them. They are very well connected in the local community. They have a ton of resources. Now, sometimes I will reach out to them myself for my own patients, but learning about these resources before you ever need them is incredibly important. And that is what these video series are about, offering you resources that you may not have been aware of to save you money. So if you're interested working with me, go to digitalnomadhealth.com. I'll leave some resources below in the description as well. Take care.